1. What is the meaning of the root word cardi in medical terminology? A. Heart. B. Lung. C. Liver. D. Kidney. Answer: A. Heart. Rationale: the root word cardi originates from the Greek cardia, meaning heart, as in cardiology, study of the heart. Lung relates to pulm, liver to hepat, and kidney to nephr. A is correct based on its definition. 2. Which root word refers to the stomach in terms like gastritis? A. Hepat. B. Gaster. C. Ren. D. Num. Answer: B. Gaster. Rationale: gaster comes from Greek gaster, meaning stomach, as in gastritis, stomach inflammation. Heput is liver, ren is kidney, and num is lung. B is correct due to its specific meaning and use in medical terms. 3. In the term nephrectomy, what does the root nephr indicate? A. Nerve. B. Kidney. C. Bone. D. Blood. Answer: B. Kidney. Rationale: nephr derives from Greek nephros, meaning kidney, as in nephrectomy, kidney removal. Nerve is nor, bone is ost, and blood is hem. B is correct due to its application in this procedural term. 4. What root word combined with itis indicates lung inflammation? A. Pulm. B. Cardi. C. Gaster. D. Hepat. Answer: A. Pulm. Rationale: pulm comes from Latin pulmo, meaning lung, forming pulmonitis, lung inflammation. Cardi is heart, gaster is stomach, and heput is liver. A is correct as it aligns with lung-related pathology. 5. How does identifying ost help decode osteoporosis? A. Indicates bone. B. Indicates muscle. C. Indicates skin. D. Indicates joint. Answer: A. Indicates bone. Rationale: ost is from Greek osteon, meaning bone, key to understanding osteoporosis, bone porosity. Muscle is myo, skin is derm, and joint is arthur. A is correct for decoding this condition. 6. What does the root word derm mean in terms like dermatitis? A. Muscle. B. Skin. C. Nerve. D. Blood. Answer: B. Skin. Rationale: derm from Greek derma means skin, as in dermatitis, skin inflammation. Muscle is myo, nerve is nor, and blood is hem. B is correct based on its definition. 7. Which root word relates to the brain in encephalitis? A. Myle. B. Nor. C. Encephal. D. Cerebr. Answer: C. Encephal. Rationale: encephal from Greek encephalos means brain, as in encephalitis, brain inflammation. Myle is spinal cord, nor is nerve, and cerebr is also brain but less specific here. C is correct. 8. In arthroscopy, what does arthur indicate? A. Bone. B. Muscle. C. Tendon. D. Joint. Answer: D. Joint. Rationale: arthur from Greek arthrin means joint, as in arthroscopy, joint visualization. Bone is ost, muscle is myo, and tendon is ten. D is correct for this term. 9. What root word in rhinoplasty refers to the nose? A. Ot. B. Rin. C. Stomat. D. Ophthalm. Answer: B. Rin. Rationale: rin from Greek res means nose, as in rhinoplasty, nose surgery. Ot is ear, stomat is mouth, and ophthalm is eye. B is correct due to its anatomical reference. 10. Which root combined with algia means muscle pain? A. Nor. B. Ost. C. Myo. D. Arthur. Answer: C. Myo. Rationale: myo from Greek mys means muscle, forming myalgia, muscle pain. Nor is nerve, ost is bone, and arthur is joint. C is correct as it matches the term for muscle pain. 11. What does heput signify in hepatomegaly? A. Stomach. B. Kidney. C. Pancreas. D. Liver. Answer: D. Liver. Rationale: heput from Greek hepar means liver, as in hepatomegaly, enlarged liver. Stomach is gast, kidney is nephr, and pancreas is pancreas. D is correct. 12. In pneumonia, what does num refer to? A. Heart. B. Lung. C. Blood.
D. Brain.
Answer: B. Lung. Rationale: num from Greek pneumen means lung, as in pneumonia, lung inflammation. Heart is cardi, blood is hem, and brain is encephal. B is correct for this condition. 13. Which root word means blood in hematology? A. Throm. B. Hem. C. Luke. D. Eryther. Answer: B. Hem. Rationale: hem from Greek haima means blood, as in hematology, study of blood. Throm is clot, Luke is white, and eryther is red. B is correct as the root for blood. 14. What does nor indicate in neuropathy? A. Brain. B. Spinal cord. C. Nerve. D. Muscle. Answer: C. Nerve. Rationale: nor from Greek neuron means nerve, as in neuropathy, nerve disorder. Brain is encephal, spinal cord is myle, and muscle is myo. C is correct for this term. 15. In osteopathy, what does ost signify? A. Joint. B. Bone. C. Tendon. D. Ligament. Answer: B. Bone. Rationale: ost from Greek osteon means bone, as in osteopathy, bone-related treatment. Joint is arth, tendon is ten, and ligament is lig. B is correct based on its meaning. 16. Which root with ectomy means kidney removal? A. Gaster. B. Nephr. C. Hepat. D. Pulm. Answer: B. Nephr. Rationale: nephr means kidney, forming nephrectomy, kidney removal. Gaster is stomach, hepat is liver, and pulm is lung. B is correct as it matches the surgical term. 17. What does OT mean in otoscopy? A. Eye. B. Nose. C. Throat. D. Ear. Answer: D. Ear. Rationale: OT from Greek us means ear, as in otoscopy, ear examination. Eye is ophthalm, nose is rhin, and throat is pharynx. D is correct for this procedure. 18. In phlebotomy, what does phleb indicate? A. Blood. B. Artery. C. Vein. D. Heart. Answer: C. Vein. Rationale: phleb from Greek phleps means vein, as in phlebotomy, vein incision. Blood is hem, artery is arter, and heart is cardi. C is correct for this term. 19. Which root means eye in ophthalmology? A. Rin. B. Opt. C. Ophthalm. D. Or. Answer: C. Ophthalm. Rationale: ophthalm from Greek ophthalmos means eye, as in ophthalmology, study of the eye. Rin is nose, opt is vision, and or is ear. C is correct as the root for eye. 20. What does decoding myocardium reveal about myo? A. Blood. B. Muscle. C. Bone. D. Nerve. Answer: B. Muscle. Rationale: myo means muscle, and in myocardium, heart muscle, it pairs with cardi, heart. Blood is hem, bone is ost, and nerve is nor. B is correct for decoding this term. 21. Which root in colostomy refers to the colon? A. Hepat. B. Kernel. C. Run. D. Gaster. Answer: B. Kernel. Rationale: col from Greek colon means colon, as in colostomy, colon opening. Heput is liver, run is kidney, and gaster is stomach. B is correct for this surgical term. 22. What does throm mean in thrombosis? A. Blood. B. Vein. C. Platelet. D. Clot. Answer: D. Clot. Rationale: throm from Greek thrombos means clot, as in thrombosis, clot formation. Blood is hem, vein is phleb, and platelet relates to thrombocyte. D is correct. 23. In cystitis, what does cyst indicate? A. Kidney. B. Bladder. C. Lung. D. Liver. Answer: B. Bladder. Rationale: cyst from Greek Cystis means bladder, as in cystitis, bladder inflammation. Kidney is nephr, lung is pulm, and liver is heput. B is correct for this condition. 24, which root with pathy indicates a heart disorder? A. Pulm. B. Heput. C. Cardi. D. Nor. Answer: C. Cardi. Rationale: cardi means heart, forming cardiomyopathy, heart disorder. Pulm is lung, heput is liver, and nor is nerve. C is correct as it aligns with heart pathology. 25. What does REN signify in renal? A. Stomach. B. Brain. C. Kidney. D. Liver. Answer: C. Kidney. Rationale: REN from Latin renes means kidney, as in renal, pertaining to the kidney. Stomach is gaster, brain is encephal, and liver is heput. C is correct. 26. What does the root myel mean in myelitis? A. Nerve. B. Spinal cord. C. Muscle. D. Brain. Answer: B. Spinal cord. Rationale: myel from Greek myelos means spinal cord, as in myelitis, spinal cord inflammation. Nerve is nor, muscle is myo, and brain is encephal. B is correct. 27. Which root in cholecystectomy refers to the gallbladder? A. Chole. B. Heput. C. Cyst. D. Gaster. Answer: A. Chole. Rationale: chole from Greek chole means bile or gallbladder, as in cholecystectomy, gallbladder removal. Heput is liver, cyst is bladder, and gaster is stomach. A is correct. 28. In bronchitis, what does bronch indicate? A. Lung. B. Airway. C. Throat. D. Chest. Answer: B. Airway. Rationale: bronch from Greek bronchos means airway or bronchus, as in bronchitis, airway inflammation. Lung is pulm, throat is pharynx, and chest is thorax. B is correct. 29. What root word means tooth in odontalgia? A. Stomach. B. Odont. C. Gingive. D. Gloss. Answer: B. Odont. Rationale: odont from Greek odous means tooth, as in odontalgia, tooth pain. Stomach is mouth, gingive is gums, and gloss is tongue. B is correct for this term. 30. Which root combined with ossus indicates bone disease? A. Myo. B. Nor. C. Ost. D. Derm. Answer: C. Ost. Rationale: ost means bone, forming osteoporosis, bone disease. Myo is muscle, nor is nerve, and derm is skin. C is correct as it aligns with bone pathology. 31. What does arter signify in arteriosclerosis? A. Vein. B. Artery. C. Blood. D. Heart. Answer: B. Artery. Rationale: arter from Greek arteria means artery, as in arteriosclerosis, artery hardening. Vein is phleb, blood is hem, and heart is cardi. B is correct. 32. In laryngitis, what does larynx refer to? A. Throat. B. Larynx. C. Trachea. D. Lung. Answer: B. Larynx. Rationale: larynx from Greek larynx means larynx, voice box, as in laryngitis, larynx inflammation. Throat is pharynx, trachea is trache, and lung is pulm. B is correct. 33. Which root word means white in leukocyte? A. Eryther. B. Leuc. C. Throm. D. Hem. Answer: B. Leuc. Rationale: leuc from Greek leukos means white, as in leukocyte, white blood cell. Eryther is red, throm is clot, and hem is blood. B is correct as the root for white. 34. What does enter indicate in enteritis? A. Stomach. B. Liver. C. Intestine. D. Colon. Answer: C. Intestine. Rationale: enter from Greek enteron means intestine, as in enteritis, intestine inflammation. Stomach is gaster, liver is heput, and colon is kernel. C is correct. 35. In splenectomy, what does splen signify? A. Spleen. B. pancreas. C. Kidney. D. Liver. Answer: A. Spleen. Rationale: splen from Greek splen means spleen, as in splenectomy, spleen removal. Pancreas is pancreate, kidney is nephr, and liver is heput. A is correct. 36. Which root with algia indicates nerve pain? A. Ost. B. Norsemio. D. Arthur. Answer: B. Nor. Rationale: nor means nerve, forming neuralgia, nerve pain. Ost is bone, myo is muscle, and arthur is joint. B is correct as it matches the term for nerve pain. 37. What does gloss mean in glossitis? A. Tongue. B. Mouth. C. Tooth. D. Gum. Answer: A. Tongue. Rationale: gloss from Greek glossa means tongue, as in glossitis, tongue inflammation. Mouth is stomach, tooth is odont, and gum is gingiv. A is correct. 38. In thoracotomy, what does thorac indicate? A. Lung. B. Heart. C. Chest. D. Rib. Answer: C. Chest. Rationale: thorac from Greek thorax means chest, as in thoracotomy, chest incision. Lung is pulm, heart is cardi, and rib relates to cost. C is correct. 39. Which root means red in erythrocyte? A. Leuc. B. Hem. C. Eryther. D. Throm. Answer: C. Eryther. Rationale: eryther from Greek erythros means red, as in erythrocyte, red blood cell. Leuc is white, hem is blood, and throm is clot. C is correct as the root for red. 40. What does decoding gastrectomy reveal about gaster? A. Liver. B. Stomach. C. Intestine. D. Pancreas. Answer: B. Stomach. Rationale: gaster means stomach, and in gastrectomy, stomach removal, it's the key root. Liver is heput, intestine is enter, and pancreas is pancreate. B is correct. 41. Which root in ureteritis refers to the ureter? A. Ren. B. Ureter. C. Cyst. D. Nephr. Answer: B. Ureter. Rationale: ureter means ureter, as in ureteritis, ureter inflammation. Run is kidney, cyst is bladder, and nephr is kidney. B is correct for this specific structure. 42. What does cost mean in costochondritis? A. Rib. B. Chest. C. Spine. D. Cartilage. Answer: A. Rib. Rationale: cost from Latin costa means rib, as in costochondritis, rib cartilage inflammation. Chest is thorac, spine is spin, and cartilage is condor. A is correct. 43. In orchidectomy, what does orchid indicate? A. Testis. B. Prostate. C. Bladder. D. Urethra. Answer: A. Testis. Rationale: orchid from Greek orchis means testis, as in orchidectomy, testis removal. Prostate is prostat, bladder is cyst, and urethra is urethra. A is correct. 44. Which root with itis indicates pancreas inflammation? A. Hepat. B. Gaster. C. Pancreate. D. Kernel. Answer: C. Pancreate. Rationale: pancreate means pancreas, forming pancreatitis, pancreas inflammation. Heput is liver, gaster is stomach, and col is colon. C is correct for this condition. 45. What does vas signify in vasectomy? A. Blood. B. Vessel. C. Vein. D. Duct. Answer: D. Duct. Rationale: vas from Latin vas means duct, as in vasectomy, duct cutting, specifically vas deferens. Blood is hem, vessel is broader, and vein is phleb. D is correct. 46. What does the root hyster mean in hysterectomy? A. Ovary. B. Vagina. C. Uterus. D. Cervix. Answer: C. Uterus. Rationale: hyster from Greek hystera means uterus, as in hysterectomy, uterus removal. Ovary is oophore, vagina is colp, and cervix is cervic. C is correct. 47. Which root in otitis refers to the ear? A. Rin. B. Ot.
C. Ophthalm.
D. Larynx. Answer: B. Ot. Rationale: Ot from Greek us means ear, as in otitis, ear inflammation. Rin is nose, ophthalm is eye, and larynx is larynx. B is correct for this condition. 48. In pharyngitis, what does pharynx indicate? A. Throat. B. Larynx. C. Trachea. D. Esophagus. Answer: A. Throat. Rationale: Pharynx from Greek pharynx means throat, as in pharyngitis, throat inflammation. Larynx is larynx, trachea is trache, and esophagus is esophag. A is correct. 49. What root word means skin in epidermis? A. Derm. B. Cutin. C. Kerat. D. Melon. Answer: A. Derm. Rationale: Derm from Greek derma means skin, as in epidermis, outer skin layer. Cutin also relates to skin but is less common. Kerat is horn and melon is black. A is correct. 50. Which root combined with ectomy indicates ovary removal? A. Hyster. B. oophore.
C. Salping.
D. Colp. Answer: B. oophore. Rationale: oophore means ovary forming oophorectomy, ovary removal. Hyster is uterus, salping is fallopian tube, and colp is vagina. B is correct for this surgical term. 51. What does salping signify in salpingitis? A. Uterus.
B. Ovary.
C. Fallopian tube.
D. Cervix.
Answer: C. Fallopian tube. Rationale: Salping from Greek salpinx means fallopian tube, as in salpingitis, fallopian tube inflammation. Uterus is hyster, ovary is oophore, and cervix is cervic. C is correct. 52. In esophagitis, what does esophag refer to? A. Stomach. B. Esophagus. C. Throat. D. Intestine. Answer: B. Esophagus. Rationale: Esophag from Greek oesophagos means esophagus, as in esophagitis, esophagus inflammation. Stomach is gastr, throat is pharynx, and intestine is enter. B is correct. 53. Which root word means black in melanoma? A. Leuc. B. Melon. C. Eryther. D. Cyan. Answer: B. Melon. Rationale: Melon from Greek melos means black, as in melanoma, black tumor. Leuc is white, eryther is red, and cyan is blue. B is correct as the root for black. 54. What does urethra indicate in urethritis? A. Bladder. B. Ureter. C. Urethra. D. Kidney. Answer: C. Urethra. Rationale: Urethra from Greek urethra means urethra, as in urethritis, urethra inflammation. Bladder is cyst, ureter is ureter, and kidney is nephr. C is correct. 55. In adenopathy, what does Aden signify?
A. Gland.
B. Lymph. C. Node. D. Tissue. Answer: A. Gland. Rationale: Aden from Greek Aden means gland, as in adenopathy, gland disorder. Lymph is lymph. Node is implied but not the root, and tissue is broader. A is correct. 56. Which root with itis indicates joint inflammation? A. Ost. B. Myo. C. Arthur. D. Nor. Answer: C. Arthur. Rationale: Arthur means joint, forming arthritis, joint inflammation. Ost is bone, myo is muscle, and nor is nerve. C is correct for this condition. 57. What does lip mean in lipoma? A. Fat. B. Skin. C. Muscle. D. Tumor. Answer: A. Fat. Rationale: Lip from Greek lipos means fat, as in lipoma, fat tumor. Skin is derm, muscle is myo, and tumor is oma, not the root. A is correct. 58. In prostatitis, what does prostat indicate? A. testis. B. Prostate. C. Urethra. D. Bladder. Answer: B. Prostate. Rationale: prostat from Greek prostates means prostate, as in prostatitis, prostate inflammation. Testis is orchid, urethra is urethra, and bladder is cyst. B is correct. 59. Which root means blue in cyanosis? A. Melon. B.
Cyan.
C. Luke. D. Eryther. Answer: B. Cyan. Rationale: cyan from Greek kyanos means blue, as in cyanosis, blue condition. Melon is black, Luke is white, and eryther is red. B is correct as the root for blue. 60. What does decoding chondritis reveal about chondr? A. Bone.
B. Joint.
C. Cartilage. D. Tendon. Answer: C. Cartilage. Rationale: chondr means cartilage, and in chondritis, cartilage inflammation, it's the key root. Bone is ost, joint is arthur, and tendon is ten. C is correct. 61. Which root in nephritis refers to the kidney? A. Run. B. Nephr. C. Ureter.
D. Cyst.
Answer: B. Nephr. Rationale: nephr from Greek nephros means kidney, as in nephritis, kidney inflammation. Run also means kidney but is less common here. Ureter is ureter, and cyst is bladder. B is correct. 62. What does kerat mean in keratitis? A. Cornea.
B. Skin. C. Hair. D. Nail.
Answer: A. Cornea. Rationale: kerat from Greek keras means horn or cornea, as in keratitis, cornea inflammation. Skin is derm, hair is trick, and nail is onyx. A is correct in this context. 63. In angiography, what does angi indicate? A. Artery. B. Vein. C. Vessel. D. Blood. Answer: C. Vessel. Rationale: angi from Greek angion means vessel, as in angiography, vessel imaging. Artery is arter, vein is phleb, and blood is hem. C is correct as it's broader. 64. Which root with oma indicates a nerve tumor? A. Norb.
C. Ost. D. Derm.
Answer: A. Nor. Rationale: nor means nerve, forming neuroma, nerve tumor. Myo is muscle, ost is bone, and derm is skin. A is correct for this pathology term. 65. What does trick signify in trichosis? A. Skin. B. Hair. C. Nail. D. Sweat. Answer: B. Hair. Rationale: trick from Greek thrix means hair, as in trichosis, hair condition. Skin is derm, nail is onyx, and sweat is hydr. B is correct. 66. What does the root lymph mean in lymphadenitis? A. Blood.
B. Gland.
C. Node. D. Lymph. Answer: D. Lymph. Rationale: lymph from Latin lympha means lymph, as in lymphadenitis, lymph gland inflammation. Blood is hem, gland is aden, and node is implied but not the root. D is correct. 67. Which root in tonsillitis refers to the tonsils? A. Pharynge. B. Tonsil. C. Larynx. D. Gloss. Answer: B. Tonsil. Rationale: tonsil from Latin tonsili means tonsils, as in tonsillitis, tonsil inflammation. Pharynge is throat, larynx is larynx, and gloss is tongue. B is correct. 68. In onychomycosis, what does onyx indicate? A. Hair. B. Skin. C. Nail. D. Foot. Answer: C. Nail. Rationale: onyx from Greek onyx means nail, as in onychomycosis, nail fungus. Hair is trick, skin is derm, and foot is pod. C is correct for this condition. 69. What root word means sweat in hydrosis? A. Derm. B. Hydr. C. Kerat. D. Lip. Answer: B. Hydr. Rationale: hydr from Greek hydros means sweat, as in hydrosis, sweating condition. Derm is skin. carat is horn, and lip is fat. B is correct as the root for sweat. 70, which root combined with algia indicates joint pain? A. Myo. B. Nor. C. Ost. D. Arthur. Answer: D. Arthur. Rationale: arth means joint, forming arthralgia, joint pain. Myo is muscle, nor is nerve, and ost is bone. D is correct for this term. 71. What does pod signify in podiatry? A. Leg. B. Foot. C. Ankle. D. Toe. Answer: B. Foot. Rationale: pod from Greek pos means foot, as in podiatry, foot care. Leg is crur, ankle relates to tars, and toe is dactyl. B is correct. 72. In craniotomy, what does crani refer to?
A. Brain.
B. Skull.
C. Spine.
D. Face. Answer: B. Skull. Rationale: crani from Greek cranion means skull, as in craniotomy, skull incision. Brain is encephal, spine is spin, and face is ephe. B is correct. 73. Which root word means neck in cervical? A. Cervic. B. Thorac. C. Cephal. D. Spin. Answer: A. Cervic. Rationale: cervic from Latin cervix means neck, as in cervical, pertaining to the neck. Thorac is chest, cephal is head, and spin is spine. A is correct. 74. What does cephal indicate in encephalopathy? A. Skull. B. Brain.
C. Head.
D. Nerve. Answer: C. Head. Rationale: cephal from Greek kephale means head, as in encephalopathy, brain disorder, within the head. Skull is crani, brain is encephal, and nerve is nor. C is correct in this broader context. 75. In mastitis, what does mast signify? A. Breast. B. Chest.
C. Gland.
D. Milk. Answer: A. Breast. Rationale: mast from Greek mastos means breast, as in mastitis, breast inflammation. Chest is thorac, gland is aden, and milk relates to lact. A is correct. 76. Which root with ectomy indicates thyroid removal? A. Thyr. B. Aden. C. Tonsil. D. Lymph. Answer: A. Thyr. Rationale: Thyr means thyroid, forming thyroidectomy, thyroid removal. Aden is gland, tonsil is tonsils, and lymph is lymph. A is correct for the surgical term. 77. What does dactyl mean in dactylitis? A. Finger. B. Toe. C. Hand. D. Foot. Answer: A. Finger. Rationale: dactyl from Greek dactylos means finger or toe, but in dactylitis, finger/toe inflammation, it commonly refers to fingers. Hand is chur, and foot is pod. A is correct in this context. 78. In ileitis, what does ile indicate? A. Colon. B. Ileum. C. Jejunum. D. Duodenum. Answer: B. Ileum. Rationale: ile from Latin ileum means ileum, part of small intestine, as in ileitis, ileum inflammation. Colon is col, jejunum is jejen, and duodenum is duoden. B is correct. 79. Which root means bone marrow in myeloma? A. Ost. B. Mile. C. Hem. D. Luke. Answer: B. Mile. Rationale: mile from Greek myelos means bone marrow or spinal cord, as in myeloma, bone marrow tumor. Ost is bone, hem is blood, and luke is white. B is correct in this context. 80. What does decoding pneumothorax reveal about num? A. Chest. B. Air. C. Lung. D. Breath. Answer: C. Lung. Rationale: num means lung, and in pneumothorax, air in chest due to lung collapse. It's the key root. Chest is thorac, air is implied, and breath is spear. C is correct. 81. Which root in duodenitis refers to the duodenum? A. Gaster. B. Duoden. C. Enter. D. Kernel. Answer: B. Duoden. Rationale: duoden from Latin duodenum means duodenum, as in duodenitis, duodenum inflammation. Gaster is stomach, enter is intestine, and col is colon. B is correct. 82. What does sphere mean in respiratory? A. Lung.
B. Air.
C. Breath. D. Chest. Answer: C. Breath. Rationale: sphere from Latin spirare means breath, as in respiratory, pertaining to breathing. Lung is pulm, air relates to num, and chest is thorax.
C is correct.
83. In gynecologist, what does gynae indicate? A. Uterus. B. Ovary. C. Woman. D. Pregnancy. Answer: C. Woman. Rationale: gynae from Greek gyna means woman, as in gynecologist, specialist in women's health. Uterus is hyster, ovary is oophore, and pregnancy is gravid. C is correct. 84. Which root with pathy indicates liver disease? A. Hepat. B. Gaster. C. Nepher. D. Pulm. Answer: A. Hepat. Rationale: heput means liver forming hepatopathy, liver disease. Gaster is stomach, nepher is kidney, and pulm is lung. A is correct for this pathology term. 85. What does FAC signify in facial? A. Head. B. Face. C. Skull.
D. Jaw.
Answer: B. Face. Rationale: FAC from Latin facies means face, as in facial, pertaining to the face. Head is cephal, skull is crani, and jaw is mandib. B is correct. 86. What does the root plur mean in pleurisy? A. Lung. B. Rib. C. Pleura. D. Chest. Answer: C. Pleura. Rationale: pleur from Greek pleura means pleura, lung membrane, as in pleurisy, pleura inflammation. Lung is pulm, rib is cost, and chest is thorax. C is correct. 87. Which root in jejunostomy refers to the jejunum? A. Jejun. B. Duoden.
C. Isle.
D. Kernel. Answer: A. Jejun. Rationale: jejun from Latin jejunum means jejunum, as in jejunostomy, jejunum opening. Duoden is duodenum, isle is ileum, and col is colon. A is correct. 88. In pericarditis, what does cardi indicate? A. Chest. B. Heart. C. Vessel. D. Blood. Answer: B. Heart. Rationale: cardi from Greek cardia means heart, as in pericarditis, heart sac inflammation. Chest is thorax, vessel is angi, and blood is hem. B is correct. 89. What root word means chest in thoracentesis? A. Pulm. B. Pleur. C. Thorax. D. Cost. Answer: C. Thorax. Rationale: thorax from Greek thorax means chest, as in thoracentesis, chest fluid removal. Pulm is lung, pleur is pleura, and cost is rib. C is correct. 90. Which root combined with itis indicates sinus inflammation? A. Rin. B. Sinus. C. Ot. D. Pharynge. Answer: B. Sinus. Rationale: sinus means sinus, forming sinusitis, sinus inflammation. Rin is nose, Ot is ear, and pharynge is throat. B is correct for this specific condition. 91. What does ven signify in venipuncture? A. Artery. B. Vein. C. Blood. D. Vessel. Answer: B. Vein. Rationale: ven from Latin vena means vein, as in venipuncture, vein puncture. Artery is arter, blood is hem, and vessel is angi. B is correct. 92. In tympanoplasty, what does tympan refer to? A. Ear canal.
B. Eardrum.
C. Ear bone. D. Outer ear. Answer: B. Eardrum. Rationale: tympan from Greek tympanon means eardrum, as in tympanoplasty, eardrum repair. Ear canal is audit, ear bone is ossicle, and outer ear is oar. B is correct. 93. Which root word means head in cephalalgia? A. Crani. B. Encephal. C. Cephal. D. FAC. Answer: C. Cephal. Rationale: cephal, from Greek kephale, means head, as in cephalalgia, head pain. Crani is skull, encephal is brain, and FAC is face. C is correct. 94. What does audit indicate in auditory? A. Ear.
B. Hearing.
C. Sound. D. Balance. Answer: B. Hearing. Rationale: audit, from Latin audire, means hearing, as in auditory, pertaining to hearing. Ear is OT. Sound relates to fawn, and balance is vestibule. B is correct. 95. In laparotomy, what does lapar signify? A. Abdomen. B. Liver. C. Stomach. D. Intestine. Answer: A. Abdomen. Rationale: lapar, from Greek lapara, means abdomen, as in laparotomy, abdominal incision. Liver is heput, stomach is gaster, and intestine is enter. A is correct. 96. Which root with ossus indicates nerve disease?
A. Myo.
B. Nor. C. Ost.
D. Derm.
Answer: B. Nor. Rationale: nor means nerve, forming neurosis, nerve disorder. Myo is muscle, ost is bone, and derm is skin. B is correct for this pathology term. 97. What does fawn mean in dysphonia? A. Voice.
B. Sound.
C. Speech. D. Throat. Answer: A. Voice. Rationale: fawn, from Greek phone, means voice, as in dysphonia, voice difficulty. Sound is broader, speech relates to log, and throat is pharynx. A is correct. 98. In gastropathy, what does gaster indicate? A. Intestine. B. Liver.
C. Stomach.
D. Pancreas. Answer: C. Stomach. Rationale: gaster, from Greek gaster, means stomach, as in gastropathy, stomach disorder. Intestine is enter, liver is heput, and pancreas is pancreate. C is correct. 99. Which root means movement in kinesiology? A. Kinds.
B. Meow.
C. Mote. D. Dynam. Answer: A. Kinds. Rationale: kinds, from Greek kinesis, means movement, as in kinesiology, study of movement. Myo is muscle, MOT is motion Latin, and dynam is power. A is correct. 100. What does decoding osteomyelitis reveal about ost? A. Bone.
B. Joint.
C. Marrow. D. Cartilage. Answer: A. Bone. Rationale: ost means bone, and in osteomyelitis, bone marrow inflammation, it's the key root. Joint is arthur, marrow is mile, and cartilage is condor. A is correct. 101. Which root in colitis refers to the colon? A. Enter. B. Kernel. C. Ile. D. Gaster. Answer: B. Kernel. Rationale: col, from Greek colon, means colon, as in colitis, colon inflammation. Enter is intestine, ile is ileum, and gaster is stomach. B is correct. 102. What does ocal mean in oculist? A. Vision.
B. Eye.
C. Lens. D. Cornea. Answer: B. Eye. Rationale: ocal, from Latin oculus, means eye, as in oculist, eye specialist. Vision is opt. Lens relates to lent, and cornea is carap. B is correct. 103. In bradykinesia, what does kinds indicate? A. Speed. B. Movement. C. Muscle. D. Slow. Answer: B. Movement. Rationale: kinds, from Greek kinesis, means movement, as in bradykinesia, slow movement. Speed is tachy/brady, muscle is myo, and slow is brady. B is correct. 104. Which root with pathy indicates kidney disease? A. Nephr. B. Hepate. C. Pulm. D. Cardi. Answer: A. Nephr. Rationale: nephr means kidney, forming nephropathy, kidney disease. heput is liver, pulm is lung, and cardi is heart. A is correct for this pathology term. 105. What does thorax signify in thoracic? A. Lung. B. Heart. C. Rib. D. Chest. Answer: D. Chest. Rationale: thorax from Greek thorax means chest, as in thoracic, pertaining to the chest. Lung is pulm, heart is cardi, and rib is cost. D is correct. 106. What does the root cyst mean in cystoscopy? A. Kidney. B. Ureter. C. Bladder. D. Urethra. Answer: C. Bladder. Rationale: cyst from Greek kystis means bladder, as in cystoscopy, bladder visualization. Kidney is nepher, ureter is ureter, and urethra is urethra. C is correct. 107. Which root in hemoptysis refers to blood? A. Pulm. B. Hem. C. Ptysis. D. Thorax. Answer: B. Hem. Rationale: hem from Greek haima means blood, as in hemoptysis, coughing up blood. Pulm is lung, ptysis is spitting, and thorax is chest. B is correct. 108. In nephrolithiasis, what does nepher indicate? A. Bladder. B. Kidney. C. Ureter. D. Stone. Answer: B. Kidney. Rationale: nepher from Greek nephros means kidney, as in nephrolithiasis, kidney stones. Bladder is cyst, ureter is ureter, and stone is lith. B is correct. 109. What root word means liver in hepatitis? A. Chol. B. Hepat.
C. Gaster.
D. Pancreat. Answer: B. Hepat. Rationale: heput from Greek hepar means liver, as in hepatitis, liver inflammation. Chol is bile, gaster is stomach, and pancreat is pancreas. B is correct. 110. Which root combined with ectomy indicates stomach removal? A. Gaster. B. Enter. C. Kernel. D. Heput. Answer: A. Gaster. Rationale: gaster means stomach, forming gastrectomy, stomach removal. Enter is intestine, col is colon, and heput is liver. A is correct for this surgical term. 111. What does Rhin signify in rhinorrhea? A. Sinus. B. Nose. C. Throat. D. Lung. Answer: B. Nose. Rationale: Rhin from Greek rhes means nose, as in rhinorrhea, nasal discharge. Sinus is sinus, throat is pharynx, and lung is pulm. B is correct. 112. In pulmonary, what does pulm refer to? A. Heart. B. Lung. C. Airway. D. Chest. Answer: B. Lung. Rationale: pulm from Latin pulmo means lung, as in pulmonary, pertaining to the lung. Heart is cardi, airway is bronch, and chest is thorax. B is correct. 113. Which root word means muscle in myopathy? A. Ost.
B. Myo.
C. Nor. D. Arthur. Answer: B. Myo. Rationale: myo from Greek mice means muscle, as in myopathy, muscle disorder. Ost is bone, nor is nerve, and Arthur is joint. B is correct. 114. What does ophthalm indicate in ophthalmoscope? A. Vision. B.
Eye.
C. Lens. D. Cornea. Answer: B. Eye. Rationale: ophthalm from Greek ophthalmos means eye, as in ophthalmoscope, eye examination tool. Vision is opt, lens is lent, and cornea is kerat. B is correct. 115. In arthrocentesis, what does arthur signify? A. Bone. B. Joint. C. Muscle. D. Tendon. Answer: B. Joint. Rationale: arthur from Greek arthron means joint, as in arthrocentesis, joint fluid removal. Bone is ost, muscle is myo, and tendon is ten. B is correct. 116. Which root with itis indicates brain inflammation? A. Cerebr. B. Encephal. C. Mile. D. Nor. Answer: B. encephal. Rationale. Encephal means brain, forming encephalitis, brain inflammation. Cerebur is also brain but less specific. Mile is spinal cord, and nor is nerve. B is correct. 117. What does OT mean in otorrhea? A. Nose.
B. Ear. C. Eye.
D. Throat. Answer. B. Ear. Rationale. OT from Greek us means ear, as in otorrhea, ear discharge. Nose is rhin, eye is ophthalm, and throat is pharynx. B is correct. 118. In phlebitis, what does phleb indicate? A. Artery. B. Blood. C. Vein. D. Vessel. Answer. C. Vein. Rationale. Phleb from Greek phleps means vein, as in phlebitis, vein inflammation. Artery is arter, blood is hem, and vessel is angy. C is correct. 119. Which root means clot in thrombolysis? A. Hem. B. Throm. C. Luke. D. Eryther. Answer. B. Throm. Rationale. Throm from Greek thrombos means clot, as in thrombolysis, clot dissolution. Hem is blood, Luke is white, and eryther is red. B is correct. 120. What does decoding cardiomegaly reveal about cardi? A. Muscle. B. Heart. C. Blood. D. Vessel. Answer. B. Heart. Rationale. Cardi means heart, and in cardiomegaly, enlarged heart, it's the key root. Muscle is myo, blood is hem, and vessel is angy. B is correct. 121. Which root in bronchoscopy refers to the airway? A. Pulm. B. Bronch. C. Thorax. D. Pleur. Answer. B. Bronch. Rationale. Bronch from Greek bronchos means airway, as in bronchoscopy, airway visualization. Pulm is lung, thorax is chest, and pleur is pleura. B is correct. 122. What does derm signify in dermatology?
A. Hair. B. Skin.
C. Nail. D. Sweat. Answer. B. Skin. Rationale. Derm from Greek derma means skin, as in dermatology, study of skin. Hair is trick, nail is onyx, and sweat is hider. B is correct. 123. In cholelithiasis, what does chol indicate? A. Liver. B. Gallbladder. C. Bile. D. Pancreas. Answer. C. Bile. Rationale. Chol from Greek chol means bile, as in cholelithiasis, bile stones. Liver is heput, gallbladder is cyst, and pancreas is pancreas. C is correct. 124. Which root with opathy indicates eye disease? A. Ophthalm. B. OT. C. Rin.
D. Nor.
Answer. A. Ophthalm. Rationale. Ophthalm means eye, forming ophthalmopathy eye disease. OT is ear, Rin is nose, and Nor is nerve. A is correct for this pathology term. 125. What does Nor signify in neuralgia? A. Brain. B. Nerve. C. Spinal cord. D. Muscle. Answer. B. Nerve. Rationale. Nor from Greek neuron means nerve, as in neuralgia, nerve pain. Brain is encephal, spinal cord is myle, and muscle is myo. B is correct. 126. What is the root ost mean in osteotomy? A. Joint. B. Muscle. C. Cartilage. D. Bone. Answer. D. Bone. Rationale. Ost from Greek osteon means bone, as in osteotomy, bone cutting. Joint is arth, muscle is myo, and cartilage is chondr. D is correct. 127. Which root in enteropathy refers to the intestine? A. Gaster. B. Enter. C. Kernel. D. Heput. Answer. B. Enter. Rationale. Enter from Greek enteron means intestine, as in enteropathy, intestine disorder. Gaster is stomach, col is colon, and heput is liver. B is correct. 128. In laryngoscopy, what does larynx indicate? A. Throat. B. Trachea. C. larynx.
D. Esophagus.
Answer, C. Larynx. Rationale. Laryng from Greek. Larynx means larynx, as in laryngoscopy. Larynx visualization. Throat is pharynx, trachea is trache, and esophagus is esophag. C is correct. 129. What root word means gland in adenitis? A. Lymph.
B. Aden.
C. Tonsil. D. Thyr. Answer, B. Aden. Rationale. Aden from Greek. Aden means gland, as in adenitis, gland inflammation. Lymph is lymph. Tonsil is tonsils, and Thyr is thyroid. B is correct. 130. Which root combined with itis indicates tongue inflammation? A. Stomach.
B. Gloss.
C. Odont. D. Gingiv. Answer, B. Gloss. Rationale. Gloss means tongue, forming glossitis, tongue inflammation. Stomach is mouth, odon is tooth, and gingiv is gum. B is correct for this condition. 131. What does myle signify in myelopathy? A. Nerve. B. Spinal cord.
C. Brain.
D. Muscle. Answer, B. Spinal cord. Rationale. Myle from Greek, mylos means spinal cord, as in myelopathy, spinal cord disorder. Nerve is nor, brain is encephal, and muscle is myo. B is correct. 132. In splenomegaly, what does spleen refer to? A. Liver. B. Pancreas.
C. Spleen.
D. Kidney. Answer, C. Spleen. Rationale. Spleen from Greek, spleen means spleen, as in splenomegaly, enlarged spleen. Liver is hepat, pancreas is pancreat, and kidney is nephr. C is correct. 133. Which root word means fat in liposuction? A. Derm. B. Lip. C. Adip.
D. Meow.
Answer, B. Lip. Rationale. Lip from Greek lipos means fat, as in liposuction, fat removal. Derm is skin. Adip also means fat but is less common here, and myo is muscle. B is correct. 134. What does trache indicate in tracheostomy? A. Larynx. B. Trachea. C. Throat. D. Lung. Answer, B. Trachea. Rationale. Trache from Greek trachea means trachea, as in tracheostomy, trachea opening. Larynx is laryng, throat is pharynx, and lung is pulm. B is correct. 135. In hysterosalpingography, what does hyster signify? A. Fallopian tube.
B. Uterus. C. Ovary.
D. Cervix. Answer, B. Uterus. Rationale. Hyster from Greek hystera means uterus, as in hysterosalpingography, uterus and tube imaging. Fallopian tube is salping, ovary is oophore, and cervix is cervic. B is correct. 136. Which root with ectomy indicates tonsil removal? A. Aden. B. Tonsil. C. Lymph. D. Pharynx. Answer, B. Tonsil. Rationale. Tonsil means tonsils, forming tonsillectomy, tonsil removal. Aden is gland, lymph is lymph, and pharynx is throat. B is correct for this surgical term. 137. What does cost mean in costal? A. Chest. B. Rib.
C. Spine.
D. Lung. Answer, B. Rib. Rationale. Cost from Latin costa means rib, as in costal, pertaining to the ribs. Chest is thorax, spine is spin, and lung is pulm. B is correct. 138. In orchitis, what does orchid indicate? A. Prostate. B. Testis. C. Urethra. D. Bladder. Answer, B. Testis. Rationale. Orchid from Greek orchis means testis, as in orchitis, testis inflammation. Prostate is prostat, urethra is urethra, and bladder is cyst. B is correct. 139. Which root means sweat in hyperhidrosis? A. Derm. B. Hitter. C. Lip. D. Carat. Answer, B. Hitter. Rationale. Hydr from Greek hydros means sweat, as in hyperhidrosis, excessive sweating. Derm is skin, lip is fat, and kerat is horn. B is correct. 140. What does decoding pneumonitis reveal about num?
A. Air.
B. Lung. C. Breath.
D. Chest.
Answer: B. Lung. Rationale: num means lung, and in pneumonitis, lung inflammation. It's the key root. Air is implied, breath is spear, and chest is thorax. B is correct. 141. Which root in urethral lithiasis refers to the ureter? A. Nephro. B. Ureter.
C. Cyst.
D. Run. Answer: B. Ureter. Rationale: ureter means ureter, as in urethral lithiasis, ureter stones. Nephro and run are kidney, and cyst is bladder. B is correct for this specific structure. 142. What does THYR mean in thyroiditis? A. Gland. B. Thyroid. C. Neck. D. Hormone. Answer: B. Thyroid. Rationale: THYR from Greek thyreos means thyroid, as in thyroiditis, thyroid inflammation. Gland is aden, neck is cervix, and hormone is not a root here. B is correct. 143. In colposcopy, what does colp indicate? A. Uterus.
B. Cervix. C. Vagina.
D. Ovary. Answer: C. Vagina. Rationale: colp from Greek kolpos means vagina, as in colposcopy, vagina visualization. Uterus is hyster, cervix is cervic, and ovary is oophore. C is correct. 144. Which root with algia indicates tooth pain? A. Odont.
B. Gloss.
C. Stomach. D. Gingiv. Answer: A. Odont. Rationale: odont means tooth, forming odontalgia, tooth pain. Gloss is tongue, stomach is mouth, and gingiv is gum. A is correct for this term. 145. What does vas signify in vascular? A. Blood. B. Vein.
C. Artery.
D. Vessel. Answer: D. Vessel. Rationale: vas from Latin vas means vessel, as in vascular, pertaining to vessels. Blood is hem, vein is phleb, and artery is arter. D is correct. 146. What does the root mast mean in mastectomy? A. Chest. B. Gland. C. Breast. D. Milk. Answer: C. Breast. Rationale: mast from Greek mastos means breast, as in mastectomy, breast removal. Chest is thorax, gland is aden, and milk relates to lact. C is correct. 147. Which root in craniotomy refers to the skull? A. Cephal. B. Crani. C. Encephal. D. FAC. Answer: B. Crani. Rationale: crani from Greek cranion means skull, as in craniotomy, skull incision. Cephal is head, encephal is brain, and FAC is face. B is correct. 148. In pneumonia, what does num indicate? A. Air. B. Breath. C. Lung. D. Chest. Answer: C. Lung. Rationale: num from Greek pneumon means lung, as in pneumonia, lung inflammation. Air is implied, breath is spear, and chest is thorax. C is correct. 149. What root word means neck in cervicitis? A. Thorax.
B. Cervix. C. Spin.
D. Cephal. Answer: B. Cervix. Rationale: cervix from Latin cervix means neck, as in cervicitis, cervical inflammation. Thorax is chest, spin is spine, and cephal is head. B is correct. 150. Which root combined with itis indicates gallbladder inflammation? A. Hepat.
B. Cole.
C. Cyst. D. Pancreat. Answer: B. Cole. Rationale: cole means bile or gallbladder, forming cholecystitis, gallbladder inflammation. Heput is liver, cyst is bladder, and pancreat is pancreas. B is correct. 151. What does pod signify in podiatrist? A. Leg. B. Foot. C. Ankle.
D. Toe.
Answer: B. Foot. Rationale: pod from Greek pos means foot, as in podiatrist, foot specialist. Leg is crur. Ankle relates to tars, and toe is dactyl. B is correct. 152. In adenocarcinoma, what does ADEN refer to? A. Cancer.
B. Gland.
C. Lymph. D. Tissue. Answer: B. Gland. Rationale: ADEN from Greek. ADEN means gland, as in adenocarcinoma, gland cancer. Cancer is carcinoma, lymph is lymph, and tissue is broader. B is correct. 153. Which root word means hair in trichopathy? A. Kerat. B. Trick. C. Onic.
D. Derm.
Answer: B. Trick. Rationale: trick from Greek thrix means hair, as in trichopathy, hair disorder. Kerat is horn, onic is nail, and derm is skin. B is correct. 154. What does lymph indicate in lymphoma? A. Blood.
B. Gland.
C. Lymph. D. Node. Answer: C. Lymph. Rationale: lymph from Latin in lympha means lymph, as in lymphoma, lymph tissue tumor. Blood is hem, gland is ADEN, and node is implied but not the root. C is correct. 155. In tympanitis, what does tympan signify? A. Ear canal. B. Eardrum. C. Ear bone. D. Outer ear. Answer: B. Eardrum. Rationale: tympan from Greek tympanon means eardrum, as in tympanitis, eardrum inflammation. Ear canal is audit, ear bone is ossicle, and outer ear is oar. B is correct. 156. Which root with ectomy indicates spleen removal?
A. Splen.
B. Hepat. C. Pancreat. D. Nephre. Answer: A. Splen. Rationale: splen means spleen, forming splenectomy, spleen removal. Heput is liver, pancreat is pancreas, and nephre is kidney. A is correct for the surgical term. 157. What does bronch mean in bronchodilator? A. Lung. B. Airway.
C. Chest.
D. Breath. Answer: B. Airway. Rationale: bronch from Greek bronchos means airway, as in bronchodilator, airway expander. Lung is pulm, chest is thorax, and breath is sphere. B is correct. 158. In gynecomastia, what does gynek indicate? A. Breast. B. Woman.
C. Uterus. D. Ovary.
Answer: B. Woman. Rationale: gynek from Greek gyna means woman, as in gynecomastia, woman-like breasts. Breast is mast, uterus is hyster, and ovary is oophore. B is correct. 159. Which root means nail in onycholysis? A. Trick. B. Onic. C. Kerat.
D. Derm.
Answer: B. Onic. Rationale: onic from Greek onyx means nail, as in onycholysis, nail separation. Trick is hair, kerat is horn, and derm is skin. B is correct. 160. What does decoding hepatomegaly reveal about hepat? A. Stomach. B. Liver. C. Pancreas. D. Gallbladder. Answer: B. Liver. Rationale: hepat means liver, and in hepatomegaly, enlarged liver, it's the key root. Stomach is gast, pancreas is pancreat, and gallbladder is cole. B is correct. 161. Which root in pharyngoscopy refers to the throat? A. Larynx. B. Pharynx. C. Trachea. D. Esophag. Answer: B. Pharynx. Rationale: pharynx from Greek pharynx means throat, as in pharyngoscopy, throat visualization. Larynx is larynx, trachea is trachea, and esophag is esophagus. B is correct. 162. What does salping mean in salpingectomy? A. Uterus. B. Ovary. C. Fallopian tube.
D. Cervix.
Answer: C. Fallopian tube. Rationale: Salping from Greek salpinx means fallopian tube, as in salpingectomy, fallopian tube removal. Uterus is hyster, ovary is oophore, and cervix is cervic. C is correct. 163. In ureteroscopy, what does ureter indicate? A. Kidney. B. Ureter. C. Bladder. D. Urethra. Answer: B. Ureter. Rationale: ureter means ureter, as in ureteroscopy, ureter visualization. Kidney is nepher, bladder is cyst, and urethra is urethra. B is correct. 164. Which root with itis indicates skin inflammation?
A. Derm.
B. Lip. C. Hitter.
D. Trick.
Answer: A. Derm. Rationale: derm means skin forming dermatitis, skin inflammation. Lip is fat, hitter is sweat, and trick is hair. A is correct for this condition. 165. What does fawn signify in phonation?
A. Speech. B. Voice. C. Sound. D. Hearing.
Answer: B. Voice. Rationale: fawn from Greek phone means voice, as in phonation, voice production. Speech relates to log, sound is broader, and hearing is audit. B is correct. 166. Which root with itis indicates bladder inflammation? A. Ureter. B. Nepher. C. Urethra.
D. Cyst.
Answer: D. Cyst. Rationale: cyst means bladder, forming cystitis, bladder inflammation. Nepher is kidney, ureter is ureter, and urethra is urethra. D is correct for this urinary term. 167. What does manu mean in manual? A. Wrist. B. Hand. C. Arm. D. Finger. Answer: B. Hand. Rationale: manu from Latin manus means hand, as in manual, pertaining to the hand. Arm is bracci, finger is dactyl, and wrist is carp. B is correct. 168. In colitis, what does col indicate? A. Rectum. B. Colon. C. Ileum. D. Stomach. Answer: B. Colon. Rationale: col from Greek colon means colon, as in colitis, colon inflammation. Rectum is rect, ileum is ile, and stomach is gaster. B is correct. 169. What does decoding pharyngectomy reveal about pharynx? A. Larynx. B. Esophagus. C. Throat. D. Tonsil. Answer: C. Throat. Rationale: pharynx means throat in pharyngectomy, throat removal. Larynx is laryng, tonsil is tonsil, and esophagus is esophag. C is correct for decoding this term. 170. In keratoplasty, what does kerat signify? A. Cornea. B. Lens. C. Retina. D. Iris. Answer: A. Cornea. Rationale: kerat from Greek keras means cornea, as in keratoplasty, cornea surgery. Lens is lent, retina is retin, and iris is irit. A is correct. 171. Which root with ectomy means pancreas removal? A. Pancreat. B. Hepat. C. Cholecyst. D. Gaster. Answer: A. Pancreat. Rationale: pancreat means pancreas, forming pancreatectomy, pancreas removal. Heput is liver, cholecyst is gallbladder, and gaster is stomach. A is correct for the surgery. 172. What does blepher mean in blepharoplasty? A. Eyelid. B. Eye. C. Cornea. D. Tear duct. Answer: A. Eyelid. Rationale: blepher from Greek blepharon means eyelid, as in blepharoplasty, eyelid surgery. Eye is ophthalm, cornea is kerat, and tear duct is lacrimal. A is correct. 173. In myelopathy, what does myle indicate? A. Spinal cord. B. Nerve.
C. Brain.
D. Muscle. Answer: A. Spinal cord. Rationale: myle from Greek myelos means spinal cord, as in myelopathy, spinal cord disorder. Nerve is nor, brain is encephal, and muscle is myo. A is correct. 174. Which root means clot in thrombectomy? A. Throm. B. Hem. C. Luke. D. Eryther. Answer: A. Throm. Rationale: throm from Greek thrombos means clot, as in thrombectomy, clot removal. Hem is blood, Luke is white, and eryther is red. A is correct. 175. What does larynx signify in laryngoscopy? A. Larynx. B. Trachea. C. Throat. D. Lung. Answer: A. Larynx. Rationale: laryng from Greek larynx means larynx, as in laryngoscopy, larynx visualization. Trachea is trache, throat is pharynx, and lung is pulm. A is correct. 176. In cystolithiasis, what does cyst refer to? A. Bladder. B. Kidney. C. Ureter. D. Urethra. Answer: A. Bladder. Rationale: cyst from Greek kystis means bladder, as in cystolithiasis, bladder stones. Kidney is nephr. Ureter is ureter, and urethra is urethra. A is correct. 177. Which root with itis indicates gum inflammation? A. Gingiv. B. Dent. C. Stomate. D. Gloss. Answer: A. Gingiv. Rationale: gingiv means gums, forming gingivitis, gum inflammation. Dent is teeth, stomate is mouth, and gloss is tongue. A is correct for this dental term. 178. What does cost mean in costal? A. Rib.
B. Chest. C. Spine. D. Sternum.
Answer: A. Rib. Rationale: cost from Latin costa means rib, as in costal, pertaining to the rib. Chest is thorax, spine is spin, and sternum is stern. A is correct. 179. In ureteritis, what does ureter indicate? A. Ureter. B. Bladder. C. Kidney. D. Urethra. Answer: A. Ureter. Rationale: ureter from Greek ureter means ureter, as in ureteritis, ureter inflammation. Bladder is cyst, kidney is nephr, and urethra is urether. A is correct. 180. What does decoding bronchiectasis reveal about bronch? A. Bronchus. B. Lung. C. Airway.
D. Chest.
Answer: A. Bronchus. Rationale: bronch means bronchus in bronchiectasis, bronchus dilation. Lung is pulm, airway is broader, and chest is thorax. A is correct for decoding this term. 181. What does the root cephal mean in cephalic? A. Brain. B. Head. C. Skull. D. Neck. Answer: B. Head. Rationale: cephal from Greek kephale means head, as in cephalic, pertaining to the head. Brain is encephal, skull is crani, and neck is cervic. B is correct. 182. Which root in prostatectomy refers to the prostate? A. Urethra.
B. Cyst.
C. Prostat. D. Orchid. Answer: C. Prostat. Rationale: prostat from Greek prostates means prostate, as in prostatectomy, prostate removal. Orchid is testicle, urethra is urethra, and cyst is bladder. C is correct. 183. In esophagoscopy, what does esophag indicate? A. Stomach. B. Throat. C. Intestine. D. Esophagus. Answer: D. Esophagus. Rationale: esophag from Greek oesophagos means esophagus, as in esophagoscopy, esophagus visualization. Stomach is gastr, throat is pharynx, and intestine is enter. D is correct. 184. What root word means tongue in glossectomy? A. Stomate.
B. Gloss.
C. Labi. D. Lingu. Answer: B. Gloss. Rationale: gloss from Greek glossa means tongue, as in glossectomy, tongue removal. Lingu also means tongue but is less common here. Stomate is mouth, and labi is lips. B is correct. 185. Which root combined with pathy indicates gland disorder? A. Lymph. B. Aden. C. Spleen. D. Hepat. Answer: B. Aden. Rationale: Aden means gland, forming adenopathy, gland disorder. Lymph is lymph, spleen is spleen, and heput is liver. B is correct for this glandular term. 186. What does crani signify in cranioplasty?
A. Brain.
B. Face.
C. Head.
D. Skull. Answer: D. Skull. Rationale: crani from Greek cranion means skull, as in cranioplasty, skull repair. Head is cephal, brain is encephal, and face is faci. D is correct. 187. In pericardium, what does cardi refer to? A. Vessel. B. Heart. C. Blood. D. Lung. Answer: B. Heart. Rationale: cardi from Greek cardia means heart, as in pericardium, around the heart. Vessel is vas, blood is hem, and lung is pulm. B is correct. 188. Which root means fat in liposuction?
A. Derm.
B. Seb. C. Lip. D. Adip. Answer: C. Lip. Rationale: lip from Greek lipos means fat, as in liposuction, fat removal. Adip also means fat but is less common here. Derm is skin, and seb is sebum. C is correct. 189. What does adip indicate in adipose? A. Skin. B. Fat. C. Muscle. D. Bone. Answer: B. Fat. Rationale: adip from Latin adeps means fat, as in adipose, pertaining to fat. Muscle is myo, skin is derm, and bone is ost. B is correct. 190. In tenotomy, what does ten signify?
A. Joint.
B. Bone. C. Tendon. D. Muscle. Answer: C. Tendon. Rationale: ten from Greek tenon means tendon, as in tenotomy, tendon incision. Muscle is myo, joint is arthur, and bone is ost. C is correct. 191. Which root with ectomy means breast removal? A. Thorac.
B. Mast.
C. Mam. D. Aden. Answer: B. Mast. Rationale: mast means breast, forming mastectomy, breast removal. Mam also means breast but is less common here. Thorac is chest, and Aden is gland. B is correct for the surgery. 192. What does pleur mean in pleurodesis? A. Chest. B. Lung. C. Rib. D. Pleura. Answer: D. Pleura. Rationale: pleur from Greek pleura means pleura, as in pleurodesis, pleura fusion. Lung is pulm, chest is thorac, and rib is cost. D is correct. 193. In tracheitis, what does trache indicate? A. Bronchus. B. Trachea. C. Larynx. D. Lung. Answer: B. Trachea. Rationale: trache from Greek trachea means trachea, as in tracheitis, trachea inflammation. Bronchus is bronch, larynx is larynx, and lung is pulm. B is correct. 194. Which root means eye in optometry? A. Ocal. B. Irid. C. Opt. D. Ophthalm. Answer: C. Opt. Rationale: opt from Greek opsis means eye or vision, as in optometry, measurement of vision. Ophthalm is eye, more anatomical. Ocal is eye, and irid is iris. C is correct. 195. What does sinus signify in sinusitis? A. Nose. B. Sinus. C. Throat. D. Ear. Answer: B. Sinus. Rationale: sinus from Latin sinus means sinus, as in sinusitis, sinus inflammation. Nose is rhin, throat is pharynx, and ear is ot. B is correct. 196. In arteritis, what does arter refer to? A. Vessel. B. Blood. C. Artery. D. Vein. Answer: C. Artery. Rationale: arter from Greek arteria means artery, as in arteritis, artery inflammation. Vein is phleb, vessel is vas, and blood is hem.
C is correct.
197. Which root with itis indicates bladder inflammation? A. Ureter. B. Nephro. C. Urethra.
D. Cyst.
Answer: D. Cyst. Rationale: cyst means bladder, forming cystitis, bladder inflammation. Nephro is kidney, ureter is ureter, and urethra is urethra. D is correct for this urinary term. 198. What does manu mean in manual? A. Wrist. B. Hand. C. Arm. D. Finger. Answer: B. Hand. Rationale: manu from Latin manus means hand, as in manual, pertaining to the hand. Arm is bracci, finger is dactyl, and wrist is carp. B is correct. 199. In colitis, what does col indicate? A. Rectum. B. Colon. C. Ileum.
D. Stomach.
Answer: B. Colon. Rationale: col from Greek colon means colon, as in colitis, colon inflammation. Rectum is rect, ileum is ile, and stomach is gaster. B is correct. 200. What does decoding pharyngectomy reveal about pharynx? A. Larynx. B. Esophagus. C. Throat. D. Tonsil. Answer: C. Throat. Rationale: pharynx means throat in pharyngectomy, throat removal. Larynx is laryng, tonsil is tonsil, and esophagus is esophag. C is correct for decoding this term.